Imagine this. You walk into a room and you have absolutely no idea why you're there. You forget the name of someone you've known for 30 years. You can't remember if you took your pills this morning or was that yesterday. Now here's what most people don't realize. That creeping forgetfulness, that fog rolling into your brain, it might not be aging at all. It might be sitting right there inside your medicine cabinet. Today, I'm going to reveal 9 widely prescribed medications that researchers have linked to rapid cognitive decline, and in some cases, symptoms that look exactly like dementia. Stay with me. This one could genuinely change your life. Welcome back to the channel. If you're new here, we focus on health information that truly matters for adults over 60. And today's topic is one of the most important videos we've ever put together. Here's something that might shock you. According to a study published in JAMA Internal Medicine, nearly 1 in 4 older adults in the United States takes a medication that is known to affect brain function and memory. 1 in 4. And the scary part? Most of them have absolutely no idea their pills could be doing this to them. Now let me be very clear before we go any further. I am not telling you to stop taking any medication. That would be irresponsible and potentially dangerous. What I am asking you to do is to become informed, to understand what you're putting into your body, and to have honest, open conversations with your doctor about the risks versus the benefits of every single pill you swallow. Because here's the truth that nobody talks about enough. Sometimes the symptoms we blame on just getting old are actually side effects. Side effects that can be reversed once the medication is changed or adjusted. So let's get into it. Here are 9 popular medications that have been scientifically linked to cognitive decline and dementia-like symptoms in seniors. Number 1. Diphenhydramine. You probably know it by its brand name, Benadryl. This is one of the most commonly used over-the-counter medications in America. People take it for allergies, for itching, and millions of seniors use it as a sleep aid because it makes you drowsy. But here's what most people don't know. Diphenhydramine is what doctors call an anticholinergic drug. That's a big word, so let me break it down simply. It blocks a chemical messenger in your brain called acetylcholine. And acetylcholine is absolutely essential for memory, learning, and clear thinking. A landmark study from the University of Washington followed over 3,000 adults aged 65 and older for more than 7 years. The researchers found that people who used anticholinergic drugs like Benadryl regularly had a significantly higher risk of developing dementia. And the more they used it, the greater the risk became. So that little pink pill you've been popping every night to help you sleep? It could quietly be eroding your cognitive function over time. Talk to your doctor about safer alternatives for sleep and allergies. There are options that don't carry this risk. By the way, if you're finding this information valuable, you might want to subscribe so you don't miss our upcoming videos on senior health. And drop a comment below. I'd love to hear which of these medications surprised you the most. Number 2. Proton pump inhibitors, commonly known as PPIs. Brand names include Prilosec and Nexium. If you've ever dealt with acid reflux, heartburn, or gastroesophageal reflux disease, also called GERD, chances are you've taken one of these. And they work wonderfully for short-term relief. The problem is, millions of seniors take them every single day, for months, even years, without ever questioning whether they still need them. A major German study published in JAMA Neurology followed nearly 74,000 seniors aged 75 and older. The researchers discovered that regular PPI users had a 44% increased risk of developing dementia compared to those who didn't take these drugs. Now, why would a stomach acid pill affect your brain? Scientists believe PPIs may increase the production of a protein called amyloid beta in the brain. If that term sounds familiar, it should. Amyloid beta plaques are one of the hallmark features of Alzheimer's disease. Does this mean you should stop taking your Prilosec tomorrow? Absolutely not. But it does mean you should have a conversation with your doctor. Ask them, do I still need this? Is there a lower dose I could take? Are there lifestyle changes like dietary adjustments or elevating my bed that could help manage my reflux without long-term medication? Many seniors are surprised to learn they were only supposed to take PPIs for a few weeks, not a few decades. Number 3. Oxybutynin, sold under the brand name Ditropan. This medication is prescribed for overactive bladder, a condition that affects millions of older adults, particularly women. If you find yourself rushing to the bathroom frequently or dealing with urinary urgency, your doctor may have prescribed this drug to help, and it does help with bladder symptoms. But here's the hidden cost. Oxybutynin is another powerful anticholinergic drug, just like the Benadryl we talked about. It crosses directly into your brain and blocks that critical acetylcholine chemical your brain needs to form memories and think clearly. Researchers at the Indiana University School of Medicine used brain imaging scans and found that older adults taking anticholinergic medications like oxybutynin showed reduced brain metabolism and increased brain atrophy. In simple terms, their brains were literally shrinking and slowing down. Now, think about that for a moment. You're taking a pill to help with a bladder problem, and it's quietly damaging your brain. Many seniors don't connect the dots because the cognitive decline happens gradually, over weeks and months. The good news is there are newer bladder medications that don't cross into the brain as easily. Medications like mirabegron, sold as Myrbetriq, work differently and may pose less risk to cognitive function. This is absolutely something worth discussing with your healthcare provider. Number 4. Statins. Specifically, lipophilic statins like simvastatin, known as Zocor, and atorvastatin, known as Lipitor. Now, I know what you might be thinking. Wait a minute. My doctor says I need my statin to protect my heart. And you may be absolutely right. Statins have saved countless lives by lowering cholesterol and reducing the risk of heart attacks and strokes. I want to acknowledge that clearly. But here's where it gets complicated. Not all statins are created equal. Some statins are what scientists call lipophilic, meaning they dissolve in fat. And because your brain is roughly 60% fat, these lipophilic statins can cross the blood-brain barrier more easily. The FDA itself has acknowledged reports of memory loss, confusion, and cognitive impairment associated with statin use. In 2012, they actually added a safety warning to all statin labels about potential cognitive side effects. Some patients report what they describe as a mental fog that lifts when they stop the medication and returns when they start again. Now, large population studies have shown mixed results. Some even suggest statins might be protective against dementia in certain populations. So what should you do? Don't panic. Don't flush your statins down the toilet. But if you've noticed changes in your memory or thinking since starting a statin, bring this up with your doctor. They might switch you to a hydrophilic statin like rosuvastatin, known as Crestor, which doesn't cross into the brain as readily. Or they might adjust your dose. Or they might determine the cardiovascular benefits outweigh the cognitive risks for your particular situation. The point is, you deserve to have that conversation. Number 5. Benzodiazepines. Brand names include Ativan, Valium, and Xanax. These are among the most commonly prescribed medications for anxiety, insomnia, and muscle spasms in older adults. And they can provide powerful, almost immediate relief. That's exactly what makes them so popular and so dangerous. Let me share a scenario many of you might recognize. You're going through a stressful period. Maybe you lost a spouse. Maybe you're dealing with chronic pain. Your doctor prescribes a small dose of Ativan or Xanax to help you cope. Weeks turn into months. Months turn into years. And slowly, so slowly you barely notice, your thinking becomes cloudier, your reactions slower, your memory less reliable. A comprehensive study published in the British Medical Journal followed nearly 9,000 older adults and found that those who used benzodiazepines had a 51% increased risk of developing Alzheimer's disease. 51%, and the risk went up with longer use and higher doses. Here's why this is so concerning. Benzodiazepines work by enhancing the effect of a brain chemical called GABA, which calms neural activity. But in older adults, the brain becomes much more sensitive to these drugs. The sedating effects last longer. They accumulate. And over time, they can cause significant cognitive impairment that mimics and may even accelerate dementia. Many seniors who have been on benzodiazepines for years don't realize there's a better way. Cognitive behavioral therapy for insomnia, gentle exercise, mindfulness techniques, and other non-drug approaches have been shown to be just as effective in many cases, without the devastating brain side effects. If you or a loved one has been taking a benzodiazepine for a long time, please talk to your doctor about a slow, gradual tapering plan. Never stop these medications suddenly, as that can be medically dangerous. Now, I want to pause for just a moment. If you're over 60 or if you're caring for an elderly parent or loved one, this information could genuinely be life-saving. Please keep watching. And if any of these medications sound familiar, don't be frightened. Be empowered. Knowledge is the first step to protection. Number 6. Amitriptyline, sold under the brand name Elavil. This is a tricyclic antidepressant that has been around for decades. While it was originally developed to treat depression, today it's commonly prescribed to seniors for chronic pain, migraines, nerve pain, and even insomnia. And here's the problem. Amitriptyline is one of the strongest anticholinergic medications on the market. Remember that word we talked about earlier? Anticholinergic. It blocks the brain chemical acetylcholine that you need for memory and thinking. On something called the anticholinergic cognitive burden scale, which researchers use to rate how strongly a drug affects brain function, amitriptyline scores a 3, the highest possible rating. Many seniors don't even realize they're taking what is essentially an outdated antidepressant for their back pain. And all the while, it could be chipping away at their cognitive abilities. Newer antidepressants, such as certain SSRIs or SNRIs, often carry a much lower anticholinergic burden. And for chronic pain, there are alternative approaches including physical therapy, certain newer nerve pain medications, and non-drug therapies that don't carry the same cognitive risks. If you've been prescribed amitriptyline, especially if you've been on it for years, this is a conversation worth having with your physician at your very next appointment. Number 7. Paroxetine, commonly known by its brand name Paxil. This one surprises many people because paroxetine is an SSRI antidepressant, a class of drugs that's generally considered safer and more modern than older antidepressants. And for the most part, that's true. Most SSRIs have relatively low anticholinergic activity, but paroxetine is the exception. Among all the SSRIs available today, paroxetine has the strongest anticholinergic properties. It stands apart from its class in a way that many prescribing doctors don't adequately communicate to their patients. Research published in JAMA Internal Medicine has specifically identified paroxetine as an anticholinergic drug associated with increased dementia risk when used long-term. And here's what makes this even more concerning. Paroxetine is notorious for being difficult to stop. It has one of the shortest half-lives among SSRIs, which means withdrawal symptoms can be intense. Many seniors feel trapped, unable to stop the medication because the withdrawal effects are so uncomfortable and unable to continue it without risking their cognitive health. The solution? There are many other excellent antidepressants that work just as well for depression and anxiety without the anticholinergic burden. Sertraline, known as Zoloft, and escitalopram, known as Lexapro, are two examples that are generally much safer for the aging brain. Again, never switch or stop an antidepressant without medical guidance, but absolutely bring this up with your doctor. Number 8. Antipsychotic medications, including Seroquel, which is quetiapine, Risperdal, which is risperidone, and Zyprexa, which is olanzapine. Now, these medications were originally developed to treat serious psychiatric conditions like schizophrenia and bipolar disorder. But in recent years, something deeply troubling has happened. These powerful brain-altering drugs are increasingly being prescribed to seniors, particularly in nursing homes and assisted living facilities, to manage behavioral symptoms like agitation, aggression, and sleep disturbances. Let me be direct with you. The FDA has placed a black box warning, their most serious type of warning, on all antipsychotic medications used in elderly patients with dementia. These drugs are associated with an increased risk of death in this population. An increased risk of death, and yet they continue to be prescribed at alarming rates. Beyond the mortality risk, antipsychotics can cause significant cognitive dulling. They can make a person with mild cognitive impairment look and feel like they have advanced dementia. They cause excessive sedation, confusion, falls, and metabolic problems. Some of these medications, like olanzapine and quetiapine, also have anticholinergic properties, adding yet another layer of cognitive risk. If your loved one is in a care facility and seems to have suddenly declined, ask about their medications. Ask specifically whether they've been started on an antipsychotic. You have every right to know. And you have every right to ask whether non-drug approaches like environmental modifications, music therapy, structured activities, or simply more attentive care could be tried first. This is one area where family advocacy can truly make a difference. And finally, number 9. This isn't a single medication. It's something called anticholinergic polypharmacy. In simple terms, it means taking multiple drugs at the same time that all have anticholinergic effects. This is perhaps the most dangerous situation of all, and it's incredibly common among seniors. Let me paint a picture for you. Imagine a 75-year-old woman named Margaret. She takes Benadryl at night for sleep. She takes Oxybutynin for her overactive bladder. She takes Amitriptyline for her nerve pain. And she takes a muscle relaxant that also happens to have anticholinergic properties. Each of these medications, on its own, might have a moderate effect on her brain chemistry. But together, the anticholinergic burden is cumulative. It stacks up. It's like adding weight after weight onto a scale. Eventually, the scale tips. A groundbreaking study from the University of East Anglia analyzed data from over 300,000 older adults and found that the more anticholinergic medications a person takes simultaneously, the higher their risk of developing dementia. And this risk increased in a dose-dependent manner, meaning more drugs and higher doses equal more danger. The tragedy is that many seniors see multiple specialists. A cardiologist prescribes one thing, a urologist prescribes another, a primary care doctor adds a third, and nobody steps back to look at the total anticholinergic load all these medications create together. This is exactly why every senior or their caregiver should do what I call a medication audit at least once a year. Bring every single medication, including over-the-counter drugs and supplements, to your doctor. Put them all on the table. And ask, do I still need all of these? Are any of these affecting my brain? Can any of these be replaced with something safer? You might be amazed at what your doctor discovers when they see the full picture. So now that you know about these 9 medications, what should you actually do with this information? Let me give you some practical steps you can take starting today. First, do not stop any medication on your own. I cannot stress this enough. Some of these drugs, especially benzodiazepines and antidepressants, can cause serious withdrawal symptoms if stopped suddenly. Always work with your doctor. Second, schedule a comprehensive medication review. Ask your doctor or pharmacist to evaluate your total anticholinergic burden. There are tools and scales they can use to calculate this. Third, ask about alternatives. For almost every medication on this list, there are safer alternatives available. You don't have to choose between treating your condition and protecting your brain. Fourth, consider non-drug approaches. Many conditions, including insomnia, anxiety, chronic pain, and even acid reflux, can be managed effectively with lifestyle changes, physical therapy, cognitive behavioral therapy, and dietary modifications. Fifth, stay mentally and physically active. Regular exercise, social engagement, brain-stimulating activities, and a healthy Mediterranean-style diet have all been shown to support cognitive health and may help offset some medication-related risks. And sixth, be your own advocate. If something doesn't feel right, if you feel foggy, confused, or not like yourself, speak up. Don't let anyone dismiss your concerns as just aging. It might be your medications, and it might be completely reversible. Let's quickly recap what we've covered today. 9 categories of medication that every senior and every caregiver needs to be aware of. Diphenhydramine, or Benadryl, the common allergy and sleep aid. Proton pump inhibitors like Prilosec and Nexium. Oxybutynin, or Ditropan, for overactive bladder. Lipophilic statins like Zocor and Lipitor. Benzodiazepines like Ativan, Valium, and Xanax. Amitriptyline, or Elavil. Paroxetine, or Paxil. Antipsychotics like Seroquel, Risperdal, and Zyprexa. And the cumulative danger of anticholinergic polypharmacy. Every single one of these medications has legitimate medical uses. Some of them are genuinely life-saving in the right circumstances. But knowledge is power. Understanding the risks allows you to make informed decisions alongside your healthcare team. Here's what I want you to remember most from this video. Not all memory loss is inevitable. Not all cognitive decline is permanent. Sometimes the fog lifts when the offending medication is changed. Sometimes the person you thought was slipping away comes right back when their drug regimen is adjusted. That is a message of hope. And I want you to hold on to it. You are not powerless in this. You have the right to ask questions. You have the right to understand what every pill is doing inside your body. And you have the right to a clear, sharp, vibrant mind for as many years as possible. Take care of yourself. Take care of each other. And never ever stop being curious about your own health. If this video opened your eyes to something you didn't know before, please share it with a friend, a family member, anyone over 60 who takes daily medication. You could genuinely help someone protect their brain. Hit that subscribe button so you never miss our senior health videos. We release new content every week designed specifically for adults over 60 and the families who love them. And leave me a comment below. Tell me, were you or a loved one taking any of these medications without knowing the risks? I read every single comment, and your stories help others feel less alone. Thank you so much for watching. I'll see you in the next video. Until then, stay informed, stay healthy, and stay sharp.